Hello, fellow physicians. Today, we're going to talk about something every practicing doctor has to deal with: continuing medical education, or CME. We all know we must earn CME credits to keep our licenses, but how many of us feel like we're just checking boxes, rather than genuinely advancing our careers? In this video, we'll walk you through 7 rules you can apply right now to choose CME activities that actually move your career forward, just like the top physician opinion leaders. Whether that means better clinical practice, stronger resume, research expertise, academic, leadership opportunities, or career promotion. Stick with me until rule number 7. Each rule is tied to a real-world scenario many of you will recognize. Let's dive in. Rule number 1. Many of us flip open the CME catalog and pick the nicest or easiest thing. But if you haven't asked yourself, what do I want this CME to achieve for me, then you risk wasting time. For example, Dr. Smith, cardiologist, wanted to move into a leadership role in his department. So instead of just doing any cardiology update, he selected a CME course on healthcare leadership, team management, and quality improvement. That choice showed up on his resume and became a talking point in his promotion interview. So before you register, ask: 1. What change do I want in my practice or career? 2. How will this CME help me make that change? Once you have the answer, you're already ahead. Set your career goal and let education follow. Download the OnPace EMD app to receive CME recommendations precisely matched to your chosen path. It's tempting to take the cool topic or the breakout new therapy, but the most impactful CME is the one that closes a gap in your practice. Research shows that well-designed CME improves physician performance and patient outcomes only when it addresses a real gap.
Example: Dr. Lee, oncologist, realized her practice had a gap in survivorship care planning. Rather than choose a generic oncology update, she selected a CME module dedicated to survivorship follow-up and integrating primary care. That led her to implement a new clinic workflow, and she was able to show measurable improvement in patient follow-up.
So, write down your practice weakness, or what you'd like to master, and match your CME accordingly. CME by itself is fine, but what makes it career-moving is when it leads to a deliverable you can show, a new protocol you implemented, a quality improvement project you led, a peer review presentation you gave. For example, Dr. Patel, emergency medicine, attended a CME on sepsis pathways, then led an initiative in his hospital that cut door-to-antibiotic time by 15%. At his next review, he referenced not just the CME, but the result. So when you pick a CME, also ask: what will I produce afterward? Who sees it? What metric will improve? Document it. Rule number 4. CME isn't only content, it's connection. The best CME environments allow you to meet peers, mentors, or institutional leaders. These can lead to collaborations, leadership roles, research invites. For instance, at a national CME conference, Dr. Gomez, neurologist, connected with a department chair from another hospital. This led to a joint regional stroke program and ultimately a leadership offer. So choose CME events, in-person or virtual, that include networking, working groups, or committee invitations, and be proactive. Introduce yourself, speak in breakouts, follow up. Don't just sit passively. Strengthen your professional network instantly. Use the OnPace EMD app to see who is attending the conference and connect directly with classmates, former colleagues, and leading experts. OnPace EMD Chat enables you to connect, chat, and meet. Most of us select CME within our current specialty niche, and that's reasonable. But if we want career movement, leadership, administration, academic roles, we also need CME that broadens our brand. For example, Dr. Nguyen, orthopedic surgeon, wanted a role in hospital leadership. He did not only a fracture reduction course, he also completed a CME in healthcare economics and physician leadership. That broadened his credibility beyond the OR and made him a candidate for his hospital's surgical leadership track. So think, where do I want to be in 3 to 5 years? What CME helps position me there? Then allocate part of your CME budget time to that. Rule number 6. Here's where many physicians stumble. They attend a great CME, collect credits, and move on, without implementing it, without embedding it. But the change happens in the after session. Case in point, Dr. Robinson, psychiatrist, completed a CME in EMR-supported measurement-based care, but didn't set anything in motion. 6 months later, nothing changed. Contrast that with Dr. Yang, gastroenterologist, who used his CME to pilot a new consult workflow, measured his results, presented them at internal rounds, and that became part of his annual review. So after your CME, schedule a next step within 7 days, track progress, report outcomes to your department or education committee. Then build on it. That's how CME moves you rather than just fills a form. Rule number 7. Finally, CME is not just take once and done. The medical world evolves rapidly, and so must your approach. According to major CME accreditation bodies, the value of CME increases when it is iterative and aligned with outcomes. Example, Dr. Wallace, pediatrician, did a CME in telehealth in 2021, implemented televisits in her practice, then in 2023, revisited a CME on digital patient engagement strategies, and now she's both improved her practice and taken on a leadership role in her hospital's digital health committee. So build your CME plan as a multi-year cycle. Assess your outcomes, identify new gaps, choose next CME, build deliverables, network, then repeat. If you view CME as a strategic investment in your career, not just a compliance burden, you'll see the difference. There you have it. 7 rules to stop wasting your CME and start making it work for your career. Let's recap. 1. Define the outcome. 2. Align to your gap. 3. Connect it to a deliverable. 4. Build your network. 5. Broaden your brand. 6. Follow through. 7. Treat it as a cycle. If you apply just one of these rules for your next CME, you'll position yourself differently. If you apply all 7, you'll begin to transform your CME from a burden into a strategic asset. If you found value here, hit the like button, subscribe, and share this with your physician colleagues. And let me know in the comments, which rule resonated most? And what's the next CME you're choosing differently because of this? Thanks for watching.